Have you ever considered how a seemingly simple detail, like um, the color or clarity of your horse's urine, could actually be the very first whisper of a hidden health story?
Absolutely. It's not just about, what comes out,
Right.
but what it's telling us about what's truly going on inside their body. That seemingly mundane detail isn't just data, it's often the earliest warning sign.
An early warning.
Yeah, think about it. A small change in urine could be your first clue to kidney distress, or maybe a serious metabolic issue, long before your horse even acts sick. That's the power we're tapping into.
You've hit on exactly why this deep dive is so important. Today we're diving into equine urinalysis, the comprehensive examination of a horse's urine.
Mm-hmm.
Our mission really is to unpack what makes this such an indispensable diagnostic tool,
Right.
how it offers this crucial window into a horse's metabolic and renal functions, and maybe why, despite being so accessible and cost-effective, it's sometimes, well, underutilized in veterinary practice.
It definitely can be.
We're going to try and extract the most important insights to show you why it's so much more than just some routine test.
It's really remarkable how much a thorough urinalysis reveals. It provides just a wealth of information about a horse's physiological state, potential pathologies, aiding in the early detection of various diseases that might otherwise present with only subtle or, nonspecific signs. It truly is like an early warning system.
It sounds like an incredibly effective early warning system for so many potential issues.
Yeah.
Now, to truly understand how it does that, let's break down the key diagnostic areas where urinalysis shines brightest. What's at the top of that list?
Well, top of the list has got to be assessing kidney function and hydration status.
Okay.
Urinalysis helps evaluate the kidney's ability to concentrate urine, essentially, how well they're doing their job of filtering waste and retaining water.
So how efficient they are.
Exactly.
Yeah.
This directly reflects their overall function and the horse's hydration. Specific gravity, or SG, is a key measure here. If we see dilute urine in a dehydrated horse, or maybe one with azotemia, that's a buildup of waste products in the blood,
Okay.
that's a critical indicator of potential renal failure or maybe other serious systemic issues.
That's a powerful clue right there. Like the kidneys are kind of shouting for help.
Pretty much, yeah.
And beyond just the kidneys themselves, it's vital for detecting urinary tract diseases, correct?
Exactly. It's essential for identifying infections, inflammation, and even structural abnormalities within the urinary tract.
How do you spot those?
We look for specific indicators like the presence of white blood cells, red blood cells, bacteria, or crystals in the urine sediment. Each one is a crucial piece of the diagnostic puzzle.
So it's not just about what's in the bladder then. It can actually tell us about systemic diseases too. That's really expanding the scope.
Indeed. It can reveal conditions far beyond the urinary tract, things like liver disease, hemolysis, which is red blood cell breakdown,
Right.
and even metabolic disorders like diabetes mellitus.
Diabetes, really.
Yeah, the presence of glucose or ketones in the urine, for example, can signal significant metabolic disturbances throughout the horse's entire system.
Okay, so we've established why it's so important. But, like anything, getting an accurate reading starts with getting the sample right.
Oh, absolutely.
This seems like the absolute crucial first step because a bad sample could lead us down completely the wrong path, couldn't it?
It absolutely could. Accurate urinalysis hinges entirely on proper sample collection and handling. The method you use significantly impacts the interpretation of results, especially when we're concerned about contamination that could skew our findings.
Let's talk about collection methods then. The simplest is often avoided sample, right? Just when a horse urinates naturally.
That's correct. It's often achieved by simply placing a horse in a freshly bedded stall. Or for mares, sometimes by gently stimulating the urethra digitally.
And for geldings or stallions?
Yeah, for male horses, collection bags, or even clean jugs can sometimes be used over the prepuce. It's often the easiest for the owner to manage.
But I'm guessing simplest doesn't always mean best for every single test you might want to run.
Precisely. You've hit the nail on the head. Voided samples are very prone to contamination from the genital tract and the distal urethra, meaning they can pick up bacteria or cells that aren't actually coming from the bladder or kidneys. This makes them less ideal for bacterial culture or for precise cellular analysis.
So if you're looking closely at cells,
Yeah, for looking at cells, what we call cytology, we generally prefer midstream and endstream samples. The idea is that the initial stream helps flush out some of that non-diagnostic debris.
okay. What about when you need something a bit cleaner, say, for a suspected infection? when contamination is a real worry.
That's where catheterization comes in. Urine collected this way is much preferred for bacterial culture because contamination is minimized.
Makes sense.
But it does require a sterile technique, and sometimes, tranquilization might be needed for the horse's comfort and, frankly, the safety of everyone involved.
Now, this next part is where things get really interesting, because the sources we looked at actually conflict a bit.
Oh.
It highlights how critical it is to get information specific to horses. One source tells us that cystocentesis, where a needle goes right into the bladder, is the gold standard for getting a completely sterile sample. Sounds ideal, right?
It absolutely is the gold standard in, say, small animal medicine. For dogs and cats, it's fantastic for sterility.
Right.
But, and this is a crucial distinction, another highly respected equine source states unequivocally that cystocentesis is not a method of urine collection in horses.
Wow. Okay, so a direct contradiction.
Exactly. It really forces us to ask, why the discrepancy, and what are the implications for a horse owner trying to understand their horse's diagnosis? It underscores that what works for a cat or dog doesn't automatically apply to a horse.
And trying to perform a cysto on a horse could be dangerous, I imagine.
It's certainly not standard practice and carries significant risks. It's just not how we typically collect urine in horses for culture.
That's a huge insight about species-specific differences and how just assuming methods carry over could lead to serious issues or maybe even an incorrect diagnosis.
Absolutely critical point.
So beyond the collection method itself, what about handling and preservation of the sample? Is it just pee in a cup and bring it in? Or is there more to it?
Yeah, not quite. There's definitely more to it. It's vital that urine samples are collected into clean, sterile containers. That's step one.
Sterile containers, okay.
And for most tests, refrigeration is crucial. You want to get it cool pretty quickly.
Why is that so important?
Well, it helps prevent the disintegration of delicate casts and cells, things we might want to see under the microscope. And it also inhibits bacterial overgrowth, which could mess up culture results. Think of it like trying to keep a fragile piece of art intact.
Gotcha. Are there any special considerations if there's going to be a longer delay before the sample can actually be analyzed? Say, if it needs to be shipped.
Yes, there are. If a delay in preparing cytology slides looking at the cells is anticipated, a few drops of 10% formalin can be added as a preservative. It essentially fixes the cells in place.
Okay.
For urine culture transport, specialized tubes containing boric acid are recommended.
Boric acid.
Yeah, it prevents bacterial overgrowth for up to maybe 48 hours at room temperature, which is great for shipping samples to a lab.
But can you use those tubes for everything?
No, and that's key. These boric acid tubes should not be used for general urinalysis or cytology. For those, you need plain tubes without additives.
Good to know.
And crucially, for the best and most accurate results across the board, samples really should be evaluated within about 1 hour of collection.
1 hour. That's fast.
It is. Otherwise, cells and casts can deteriorate, and crystals might actually dissolve or even form in vitro, meaning in the tube after collection.
So time is really of the essence. Once we have a good, properly handled sample, what's the very first thing you look at, even before you get to the fancy lab equipment?
That would be the macroscopic examination, the initial visual assessment of the urine's physical characteristics. This is the first impression, just looking at it.
What's normal when it comes to color for a horse? I imagine it's generally yellow, like for most animals.
Exactly. Normal equine urine is typically some shade of yellow, but color changes can tell us a lot.
Like what?
Well, a red to reddish-brown discoloration can indicate hematuria, meaning blood in the urine.
Okay.
Or it could be hemoglobinuria or myoglobinuria, which are pigments from systemic muscle breakdown or red blood cell breakdown elsewhere in the body.
What about other colors?
Green or brown colors can definitely suggest illness. And clear urine, on the other hand, might simply indicate dilution. Maybe the horse just drank a lot.
That's incredible. Now, I hear this a lot from owners, especially in winter. If they see a reddish stain on the snow or shavings from their horse, should their first thought automatically be blood? Because that causes a lot of panic.
That's a really common misconception, and you've hit on something important. It's true that normal equine urine may naturally turn brown or red after prolonged storage or exposure to air. This is due to the oxidation of certain pigments.
Ah, oxidation.
Yeah. And yes, it often appears reddish on snow or shavings, which can certainly alarm an owner unnecessarily. That's why context is always key.
Okay, that's a huge relief for many owners listening, I'm sure. And what about clarity? Normal equine urine is often cloudy, right? That always struck me as odd compared to, say, my dog's urine.
You're right to notice that. Normal equine urine is often cloudy, and this is completely normal for them.
Why is that?
It's due to the natural presence of calcium carbonate crystals and mucus. It's just part of their normal makeup.
Okay, so cloudy isn't necessarily bad.
Not necessarily. However, excessive cloudiness can suggest issues like abnormally high numbers of crystals, leukocytes, red blood cells, bacteria, or even things like lipids or sperm.
So there's a difference between normal cloudy and really cloudy.
Exactly. And it's also important to remember that cloudy urine upon standing is common for horses and doesn't necessarily indicate pathology. It's just their unique chemistry.
And speaking of those general observations, while we can't measure volume precisely in a single sample, I imagine dramatic changes in a horse's normal urine output would be a major red flag, right?
Absolutely.
What are horse owners typically seeing that makes them think, okay, I need to call the vet about this?
Sudden changes, whether a horse seems to be urinating constantly, much more frequently, or straining, or perhaps barely urinating at all, those are huge indicators. It's like the horse is sending out a very clear signal that something's off balance.
And that's often when urinalysis comes into play.
That's often when we turn to urinalysis to try and pinpoint the underlying problem.
So we've covered what our eyes can tell us about a horse's urine, those first visual hints. But to truly dig deeper, we need to move from observation to investigation. Let's talk about the chemical clues, those microscopic signals revealed by, say, a dipstick test.
Right, the Regent strips.
These are convenient for a rapid evaluation, but I hear there's a big caveat for horses. Is that right?
There is, yes. While they are convenient, their accuracy can vary significantly, especially in equine urine.
Why is that?
Well, partly it's due to the normal alkalinity of horse urine, which can interfere with some of the chemical reactions on the Regent pads.
Yeah.
So while they offer quick, semi-quantitative results, they're not universally reliable for every parameter in horses.
Okay, so it's not a perfect tool for them. What indicators are actually reliable on a dipstick for horses, and which ones should we be wary of? Give us the quick rundown.
Sure, they are generally accurate for pH, glucose, protein, though, with some caveats. We can discuss pigment and bilirubin.
Okay, those are fairly reliable.
Generally, yes. However, for horses, they are not reliable for specific gravity, white blood cells, nitrite, or leukocyte esterase.
So SG and signs of infection, don't trust the dipstick for those.
Exactly. For those parameters, we really need more precise lab methods to get an accurate picture.
Let's unpack some of those key parameters then, starting with pH. What's considered normal for a horse and what influences it?
Right, pH. Normal equine urine is alkaline, typically ranging from 7.0 to 9.0, meaning it's quite basic.
Which is pretty different from humans.
Very different. Interestingly, foals tend to have a more acidic pH, usually between 5.0 and 7.0, more like us.
What affects the pH in adults?
Diet can play a role, especially high concentrate feeds. And even the presence of certain urease-producing bacteria can make it more alkaline.
What if it's acidic? Is that bad?
If we see aciduria or acidic urine in an adult horse, that can indicate things like metabolic acidosis, potentially dehydration, or even anorexia if they're not eating.
And specific gravity, which you mentioned the dipstick isn't great for, but it's a valuable indicator of kidney function.
Yeah.
How do we interpret that properly, and what are the normal ranges?
Okay, so SG measured properly, usually with a refractometer.
Right.
Normal ranges for horses are typically 1.020 to 1.050. When we see a low SG, something we call hypothonuria or isosthenuria.
Meaning dilute urine.
Exactly. It's essentially telling us the kidneys aren't doing their job of concentrating the urine effectively. It's like their filtering system is letting too much water pass through.
And that means?
Well, it can be a really significant red flag for impaired renal function, potentially even kidney failure.
Wow.
But sometimes it's also due to less severe things like maybe a horse just drank a massive amount of water, or perhaps if they're on certain medications like diuretics.
So context matters. What about high SG?
High SG, or hypersthenuria, suggests concentrated urine. This should always be interpreted alongside blood tests like blood urea nitrogen, BUN, and creatinine levels to get the full picture of kidney function and hydration.
And you mentioned a better test.
Yes, for the most accurate measure of urine solute concentration, we use a lab test called osmometry. That's the gold standard for concentration.
Gotcha. What about protein in the urine, proteinuria? What causes that, and how do we make sense of it if we find it?
Right, protein. When we see protein in the urine, it's kind of like finding a leak in a plumbing system. We need to figure out where that leak is originating.
Okay, good analogy.
Proteinuria can result from various causes. We categorize them as pre-renal, renal, or postrenal.
Break those down for us.
Sure. Prerenal factors mean the problem is actually happening before the kidneys, maybe from a fever or strenuous exercise putting strain on the body.
Okay.
Renal issues mean the kidneys themselves are faulty. Perhaps they're tiny filters, the glomeruli or the tubules are damaged.
The leak is in the kidney itself.
Precisely. And postrenal causes mean the protein is entering the urine after it's left the kidney, perhaps from inflammation, hemorrhage, or infection in the bladder or urethra.
So downstream from the kidney.
Exactly. Now, dipsticks are sensitive to albumin, which is a type of protein, but they can give false positives in alkaline urine, which, as we said, is common in horses.
Another dipstick issue.
Right. So a chemistry analyzer provides much more accurate protein quantification. And here's a critical insight. If you see significant proteinuria, but you don't see white blood cells, red blood cells, bacteria, or casts in the sediment,
Okay.
that pattern might strongly suggest primary kidney diseases like glomerulonephritis or amyloidosis, where the kidney filters themselves are the main problem.
That's a very specific clue then.
It can be, yes.
What about glucose? Does finding glucose in a horse's urine always mean diabetes? Because for humans, that's often the first thought.
Not necessarily, and this is where it gets really interesting and can be quite counterintuitive for many horse owners. Glucosuria glucose in the urine occurs when blood glucose levels exceed the kidney's capacity to reabsorb it, what we call the renal threshold. It's approximately 160, 180 mg/dL in horses. Now, this can be due to systemic issues like stress, sepsis, intense exercise, pituitary pars intermedia dysfunction, PPID or Cushing's, or actual diabetes mellitus, which is rare in horses.
Okay.
It can also be caused by certain drugs like alpha-2 agonists used for sedation or corticosteroids. But the fascinating part, the real aha moment for vets, is that glucosuria without hyperglycemia, meaning glucose in the urine, but normal blood sugar levels.
Wait, so sugar in the pee, but not in the blood.
Exactly. That pattern may actually suggest primary tubule dysfunction in the kidneys themselves. The tubules aren't reabsorbing the glucose like they should, even though blood levels are normal.
Wow, so it's not necessarily a blood sugar problem. It could be a specific kidney problem.
Precisely. It's a key distinction.
That's a huge insight. So for our listeners, that means even if a horse's blood sugar test looks normal, finding glucose in their urine could actually point to a kidney issue, not just a metabolic one. That's definitely a vital distinction for diagnosis.
Absolutely. It changes how you approach the case.
Okay. What about ketones? I understand they're rarely detected in equine urine, but if they are present, what might that indicate?
You're right, they are uncommon. But their presence can point to a negative energy balance or other metabolic derangements.
Like the horse isn't getting enough calories?
Often, yes. Or situations where the body is breaking down fat excessively for energy, like in hyperlipemia in ponies, or sometimes severe illness.
And bilirubin or urobilinogen? Briefly, what do those tell us?
Okay, bilirubin in the urine is associated with conditions like intravascular hemolysis, where red blood cells are breaking down inside the vessels, hepatic necrosis, which is liver cell death, and obstructive hepatopathies, where the bile duct is blocked.
So liver or blood cell issues?
Generally, yes. Urobilinogen, on the other hand, indicates a patent or open bile duct. Increases might suggest hemolytic disease, hepatic disease, or posthepatic disease. Its absence could suggest bile duct obstruction.
Got it. Finally, blood in the urine or pigmenturia. Dipsticks detect hemoglobin, myoglobin, or actual red blood cells. How do we differentiate between those? Because they need very different things, right?
They do, and it's crucial to differentiate. Hematuria means intact red blood cells are present in the urine, indicating hemorrhage somewhere in the urogenital system, kidneys, bladder, urethra, etc.
Actual bleeding.
Right. Hemoglobinuria, or myoglobinuria, however, suggests systemic muscle breakdown, myoglobin, or red blood cell breakdown, hemoglobin, where the pigment is released into the bloodstream and then filtered out by the kidneys into the urine. The problem isn't bleeding in the urinary tract itself.
So how do you tell the difference?
It requires further assessment. You'd look at the horse's plasma. Is it pink, indicating hemolysis? Are muscle enzymes elevated, suggesting myoglobinuria? And crucially, you look at the urine sediment under the microscope.
To see if actual red blood cells are there.
Exactly. If you see lots of RBCs, it's likely hematuria. If the dipstick is positive for blood, but you see few or no RBCs in the sediment, you suspect hemoglobin or myoglobin.
And the alkaline urine issue again?
Yes, just to complicate things, a positive blood reading on the dipstick can sometimes be a false positive if the urine is extremely alkaline, which, again, is common in horses. So microscopy is key.
So we've covered what you can see with the naked eye and what the chemical tests reveal. But for the real deep dive, to uncover the tiny details that often tell the biggest stories, you need to bring out the microscope for the sediment examination.
Absolutely. This is where we get down to the nitty-gritty.
You said this is absolutely crucial for deeper insight. Why?
It truly is. This examination, typically performed on a centrifuged sample to concentrate the elements down.
Spit it down, right?
Yeah, spin it down. It's critical for identifying cellular elements and other structures that aren't visible or accurately detectable macroscopically or just with dipsticks. It's often where we find the real smoking guns, the definitive clues.
What are the key elements you're meticulously looking for under that microscope?
We look for several things: red blood cells, RBCs, white blood cells, WBCs, various types of epithelial cells, casts, crystals, and microorganisms like bacteria or fungi.
Okay, let's take those one by one. Red blood cells.
Normal urine should have very few, typically less than 5 per high power field under the microscope. Increased RBCs, that's hematuria, indicate hemorrhage somewhere in the urogenital system.
Though you mentioned collection can cause some.
Right. It's important to remember that iatrogenic hemorrhage bleeding caused by the procedure can occur from sample collection methods like catheterization trauma. So you interpret the number in context.
Makes sense. And white blood cells, what do they signify?
Similarly, normal urine contains few white blood cells, again, usually less than 5 per high power field. Increased WBCs, which we call pyuria.
Pyuria, okay.
That strongly suggests inflammation, infection, trauma, or even neoplasia, like a tumor or abnormal tissue growth somewhere in the urinary tract.
So a sign of trouble.
Definitely. And it's important to note that even if we see pyuria, high white cells, without seeing obvious bacteria under the scope, it may still warrant a bacterial culture. Bacteria can be present, but just not easily visible, or maybe it's inflammation without infection.
Okay. What about the epithelial cells you mentioned? Do they all mean the same thing, or are there different types that tell you different things?
Not at all the same. We differentiate between squamous epithelial cells.
Squamous?
Yeah, they're large, flat cells. They're common contaminants, often picked up from the genital tract or the very end of the urethra, especially in voided samples, so we usually disregard those.
Okay, contaminants. What else?
Then there are transitional epithelial cells. These line the bladder, ureters, and upper urethra. Seeing a few is normal, but increased numbers can indicate inflammation or irritation higher up in the urinary tract.
And any other types?
Rarely, you might see renal tubular epithelial cells, which come from the kidney tubules themselves. Seeing those is usually a sign of kidney damage. Also, large clumps of epithelial cells or atypical-looking cells might raise suspicion for neoplasia, but chronic infection can also cause cells to look unusual or atypical.
So cell type and appearance matter. And then there are casts. These sound pretty telling, like they're literally molds of the inside of the kidney tubules.
That's a perfect analogy. That's exactly what they are. Casts are cylindrical structures formed right inside the renal tubules. They act like tiny molds of that space.
What are they made of?
They're primarily made of sloughed cells from the tubules and a specific protein called tam-horsfall glycoprotein, which sort of acts like glue.
And seeing them means?
Their presence almost always indicates tubular damage, inflammation, or infection within the kidney itself. They're a direct sign of trouble in the kidney tubules.
Are all casts bad?
Well, what's fascinating here is that while hyaline casts, which are mostly protein or fine granular casts, may be seen in very small numbers normally, especially in concentrated urine, other types, like cellular casts containing WBCs or RBCs or epithelial cells or waxy casts, are always abnormal and signify active kidney issues.
And you mentioned they're fragile.
Extremely. This is why prompt analysis is so important. Casts are fragile structures, and they degenerate over time, especially in alkaline urine, which horse urine is. So if you wait too long to examine the sample, you might miss these really important clues.
Time is critical again.
Yep.
Okay, crystals are often seen, right? Especially those calcium carbonate ones you mentioned, making the urine cloudy. Are they always a sign of trouble, like impending kidney stones?
That's a common question. Equine urine is normally very rich in calcium carbonate crystals, and sometimes calcium phosphate and oxalate crystals may also be found. It's just normal for horses.
So finding crystals isn't automatically bad.
No, and this is a critical point. The clinical significance of crystalluria, seeing crystals, should always be interpreted in conjunction with the horse's clinical signs. Their presence alone does not necessarily indicate urolithiasis or stones. Many healthy horses have lots of crystals.
To know.
Also, remember that crystals can actually form or dissolve in vitro in the sample container itself due to temperature changes or delayed analysis. So seeing them in the lab doesn't always mean they were there in the horse.
So interpretation is key.
Mm.
And finally, microorganisms. Bacteria, fungi, protozoa, what about those?
Right. Bacteria seen in the sediment can be either contaminants from the collection process, especially in voided samples,
Hmm?
or they can be true pathogens causing an infection. Their presence, especially alongside white blood cells, pyuria, strongly suggests a urinary tract infection.
But you might not always see them.
Correct. Bacteria may be present, but below detectable limits in the sediment examination, which is why culture is sometimes necessary for definitive identification, even if you don't see bacteria under the scope. Fungi and protozoa are less common findings, but can also be observed and are generally always significant if found.
Okay, so we've gone from the macroscopic view to the chemical clues to the microscopic details in the sediment. But for the true deeper dives, maybe to pinpoint specific treatments or assess kidney damage more quantitatively, we turn to urine culture and sensitivity, and something called the urine protein creatinine ratio.
Exactly. These are often follow-up tests based on the initial urinalysis findings.
Why are these crucial, especially after all the other tests we've just discussed? Let's start with culture and sensitivity.
Urine culture and sensitivity testing is absolutely crucial for definitively identifying the specific bacterial pathogen causing an infection and determining the most appropriate antimicrobial therapy.
So knowing exactly what bug it is and what kills it.
Precisely. It's indicated whenever a urinary tract infection is suspected, especially if pyuria is present on the sediment exam, or perhaps if an initial antibiotic treatment based on suspicion isn't working. It takes the guesswork out of antibiotic choice.
And for that, I'm assuming sterile collection methods like catheterization are paramount to get accurate results. You can't culture contaminants.
They are absolutely non-negotiable for a meaningful culture. Sterile collection methods like catheterization are essential to minimize contamination before the urine sample is inoculated onto the special culture media.
And the results tell you.
The results then not only identify the specific organism like E. coli or Streptococcus, but also provide an antimicrobial susceptibility pattern.
Sensitivity testing.
Right. It tells us if the bacteria are sensitive, intermediate, or resistant to various common antibiotics. This information is vital for combating the growing problem of antibiotic resistance by guiding the selection of the most effective antibiotic, ensuring we don't use a drug that won't work or contribute to resistance.
Makes perfect sense. What about the urine protein creatinine ratio, or UPC? What's its purpose and why is it so important? It sounds quite specific.
Think of the UPC ratio as our gold standard, sort of super accurate test for measuring protein leakage from the kidneys, specifically when we're really concerned about potentially serious kidney trouble.
How does it work?
It essentially normalizes the amount of protein being excreted in the urine relative to the amount of creatinine being excreted. Creatinine is filtered pretty constantly by healthy kidneys.
Okay.
So by comparing protein to creatinine in the same sample, it removes the effect of how concentrated or dilute the urine might be at that moment. This gives us a much clearer, more quantitative picture of whether the kidneys themselves are actually losing excessive protein.
If we connect this to the bigger picture, what does a high UPC ratio really mean for a horse owner and their vet?
Well, while the specific reference value mentioned in one source, UPC 2.0, was for dogs indicating significant protein loss,
Right.
the general principle absolutely applies to horses. A persistently high UPC ratio is a powerful indicator that protein is escaping through the kidney's filters, which is a key sign of glomerular damage or other significant kidney disease. It allows us to detect and quantify kidney disease, sometimes even in its early stages when other blood values might still look normal.
So it can be an early detector of kidney damage.
It certainly can be more sensitive than just blood work for detecting protein-losing kidney disease. But it's important to remember, this test should really only be performed on urine that is free of visible blood and significant inflammatory cells.
Why is that?
Because hemorrhage or inflammation lower down in the urinary tract can add protein to the urine, causing falsely high UPC ratios that don't actually reflect kidney leakage.
Yeah.
You need a quiet sediment for an accurate UPC.
Wow. Okay. So stepping back and looking at everything we've discussed, what does this all mean for you, our listener? We've really journeyed through how a seemingly simple biological sample, maybe often dismissed, can hold such complex and absolutely vital clues about an animal's well-being.
Exactly. It just highlights how powerful accessible, and really inexpensive a diagnostic tool urinalysis truly is. When it's performed, meticulously getting the collection right, handling it properly, doing the test correctly, and then interpreted carefully in conjunction with a horse's clinical signs and history,
Hmm.
it plays such a critical role in the early diagnosis, the effective management, and the ongoing monitoring of a really wide array of equine diseases, not just kidney problems. It's a cornerstone of good equine preventative care and diagnostic medicine.
It really is. And it makes you think, doesn't it? Consider this. Something as visually alarming as pigmenturia, that discolored urine we talked about,
Hmm.
that can actually result in permanent renal tubular damage if the underlying cause, like muscle breakdown or hemolysis, isn't addressed quickly.
That's true. The pigments themselves can be toxic to the tubules.
Or how something like uncorrected dehydration, which maybe we think of as simple to fix, can potentially lead to permanent renal compromise in a horse if it goes on too long or is too severe.
Absolutely. Kidney health is so reliant on good hydration.
It raises this important question, I think. What other overlooked details in our world, maybe in our own lives or the lives of our animals, might be whispering profound secrets if we only knew how to listen and look deeper?
That's a great thought to end on. What are we missing by not looking closely enough?